I think that it's important that a prosthodontist is creative. Of course, you need to have a basic understanding of the anatomy and what works and what's proven, and also have some compassion for the patient. But I think creativity is a huge part of being or thinking like a prosthodontist. We had an assignment in our class to make a problem solving denture. We could make it out of what we wanted. And I enjoyed it a lot because I got to think, what do I want it to look like in the end and how can I get there? And often it means thinking outside the box. There are academic techniques and different techniques, but just because those are the proven way doesn't mean it's the only way. And although we need to follow those basic guidelines, we have some lenience and creativity in making it look good and I guess solving problems. So I made a selfie denture, and the biggest thing that I noticed, some problems that I would imagine people that wear dentures would have, would be that it's hard to talk, it's hard to eat, it's hard to swallow, um, it's annoying, you feel dumb around people. For me, the taste was terrible, as if I had poison in my mouth, but it was a good experience. I feel bad for those people that have to wear dentures. I want to briefly talk about Edentulism. Um, I think when it comes down to it, the provider needs to remember that nothing is going to work better than the natural teeth, what God gave them. Um, the times that you would get a denture is when that has failed and when they are edentulous or there's no other option. And the problems with dentures, they may be better than being edentulous and not being able to eat. But just with a normal denture, there are a lot of problems associated with it, including fit. So we're going to talk about fit for a few minutes. The benefit of a denture is that compared to being edentulous, it gives you the option that you're able to be more comfortable in public around people. Most people would rather have some nice looking teeth than being completely edentulous and having a bitter beer face. And it also allows you to eat foods, but there are a lot of limitations to it. With a denture, it can affect your speech. It can be uncomfortable. The fit can not be right. It can cause sores. It can, especially in the mandible, the mandibular dentures are never comfortable. There's always problems. People are limited on what foods they can eat, and in the end, there's just a lot of problems with a normal denture. An overdenture looks like a normal denture, except that it has one or two implants in the arch, either maxillary or mandibular, or both. And there are little clasps inside of the denture that snap on to the implant and give it more stability. Compared to a normal denture, this is eons better. It allows the patient to eat more foods. The denture is not going to be rocking around, flopping as much. They will feel like it's more stable. It's going to cost more, but it's better than a normal denture. Talk about a hybrid denture. A hybrid denture is a denture where there are multiple implants placed into the arch, and instead of snapping on and being removable like a overdenture, these are not really removable by the patient, but they can be removed by the provider or the dentist. This is done by placing screws in through areas on the denture, and this allows a lot of benefit for the patient, especially on the maxillary arch where you don't need to have the palate. So this provides a more natural feel, feels more like natural teeth, and it's more stable, more rocking. They can eat apples, they can eat pretty much anything they want. Very stable, almost feels like this is almost as close as you're going to get to real teeth besides doing implants. One of the best experiences for me this semester was our professor set up an opportunity where edentulous patients came in, and we, the students, got to take impressions, practice that, and make a wax rim and all that. But we made the denture without having the proper measurements, and then we tried it in, and it was great to see how I guess what was wrong. Some of them were the teeth were horse teeth, way too far out. Some of the teeth were way too long. Maybe their smile looked too wide, or maybe it was too narrow. It didn't fit well. The teeth weren't shaped well for their face or their mouth. They were too big or too small. And this really helped me realize the importance of there is a theory of idealism. Each person has a look that's going to look best on them, and it's important to follow those principles and do it while the patient is there. The first step in making a denture is by taking an alginate impression. Next, you use this alginate impression to pour up stone models. Using the stone models, we place triad to make a custom tray for impressions. Then we place wax on top, making a rim. This is known as the Wayne Newton rim. The triad is then trimmed to remove all sharp edges, and a thin layer of PVS is placed throughout the Wayne Newton rim, and an impression is made using the P90X technique, where we manipulate cheeks and lips and motion that they would make in speaking and function. This process is done for both the mandibular and maxillary arches, making sure to fill in all bubbles or voids using light body PVS. This picture shows a model with lips resembling a patient whose lips are in repose or rest. Using this model, we were able to determine the buccal and lingual position of the maxillary central incisors, referring to how far anteriorly or posteriorly it is. Also, with these reposed lips, we were able to determine the incisal length of the maxillary central. Now, other students in our class had models with lips that are in smiling, and with the smiling position, this is how we determine the maxillary occlusal plane angle, the buccal corridor, or how wide it is, the maxillary midline angle, and the zenith lines. And also in repose, with the model we had, we would use the buccal and lingual position of the mandibular, or we could determine the buccal and lingual position of the mandibular central incisors. And while smiling, the incisal length of the mandibular central incisors. In our class, we called these 9 steps dress to the nines, and it is used to determine the mesoaesthetics. In this class, we use these models to determine the mesoaesthetics, but in real life it would be used on a patient, or they would be measured on a patient to determine what looks best what would function best for the patient. Now it is time to mount the model on an articulator and to begin to set teeth. In our class, we use the principle of microaesthetics, which we also call dressed to the nines, the 9 steps, to determine how the teeth should look and how they would best work and function. These steps include the central maxillary papilla midline, the midline perpendicular to the incisal edge, proportions of the maxillary central incisors, widths of the maxillary anteriors, lengths of the maxillary teeth, apical progression of contacts and embrasures, harmony of posterior cusp edges, symmetry of zenith and antizenith positions and angles, and length of the papillas. Once we have finished setting the teeth, it is now time to try in our denture in the live patient, knowing that it would not be exact, but hoping we could learn from our mistakes. When we tried the maxillary denture in the live patient, the teeth looked okay, but the main problem was that there was too much gingiva showing during smiling. The cause of this was because we did not do the accurate measurements beforehand, since we did not have the opportunity to do the impressions on the patients before. Another thing that we saw that we did not like and that did not look good was that the maxillary anterior teeth jutted out a little bit too far and looked like horse teeth. This was a great learning experience, and we were all grateful for this opportunity to be able to learn from our mistakes and actually do it wrong purposefully. We have here a picture of a lady. Obviously it has been photoshopped, but on the front is a healthy individual with teeth, a dentulous individual, and in the back is a picture showing what that individual would look like if they were edentulous. What happens over time when teeth are lost, their bone begins to resorb because there is nothing, no roots of teeth holding it there. The first part that resorbs is the mandible, followed by the maxilla, and then after many years the mandible begins to move forward again, which gives you that distinct witch's chin that we see here. The problem with this is that this means that a denture wearer is going to continually need to change their denture to reline or rebase. We're going to speak about those right now. I want to speak about relining and rebasing a denture. Once the denture stops fitting for whatever reason, you need to make it so it fits again. Let's say that my mandible has resorbed, here's my old denture, and now this denture is starting to rock. To reline a denture, you simply place wet acrylic in this intaglio surface, and then you would push the denture into their mandible and the mandibular arch and let it set, let the acrylic set. This will take a few minutes, but it allows you to refit the denture and see how it fits. This can be done on a stone model as well. A rebase is similar to a reline, except it takes a lot more work. Instead of simply placing acrylic inside the intaglio surface, you actually file down everything, both buccal and lingual, vestibular, till all you're pretty much left with is the teeth. Before you have done that, though, you take an impression of a denture so you know what the exterior should look like, and then after that you use an impression and a stone model to refit with new acrylic the denture and how it will best fit the patient. So this is a bit more accurate, and it makes it so it's less bulky than a reline could be. With an overdenture, the clasps that attach to the implant often need replacing. To do this, one simply cuts out the old clasps with a burr until removed, and then putting acrylic in, places new clasps in and snaps them onto the denture. Setting them in hot water will allow the acrylic to set. In order to repair a normal denture that is snapped in half, you would carve away where the break is, take away a little. First you'd make a stone model, take away, and then reapply acrylic until it is secure and set. One of the main things that I learned from going into the clinic and seeing patients was about the importance of professionalism. Something I realized is that you really got to watch what you say. They don't really know everything, but there are some words you got to watch out and you don't want to say to make the patient afraid or uncomfortable. And the most important thing about being professional is really caring for them, caring for their opinions, treating them respectfully, valuing their advice and listening to them, and showing them that you really are going to listen to it and try your best to please them and put out a product that they'll really appreciate. A few ideas for improving dentures and making it a more pleasant experience and also making them a better quality. And a big problem that denture wearers have is that they often break. If you're going to drop them, they're going to break, you're going to need to do a repair. Why don't we just make dentures out of a better material? instead of using acrylic, although that's been used for hundreds of years, why don't we use something like this bottle here, Nalgene. They remember when I was a kid, we used to try and break them. They would encourage you, if you ever broke your Nalgene bottle, they would replace it. The thing's invincible. Why don't we make denture out of that kind of plastic instead? And another idea is maybe into the plastic, why don't we implant a antibiotic like triclosan, which they do in a lot of children's toys to prevent bacterial growth and infection.